Hey, welcome to Below the Skirt with Tamara. I am Tamara Green, pelvic physical therapist, and I help women overcome uncontrolled bladders, return to pleasurable sex, manage those pregnancy symptoms to become postpartum champions. So, hope all is well. How are you doing with your um your squat challenge? Today is rest day, so if you're keeping up, today is rest day. If you are not keeping up, it's okay. You can always hop on anytime you're ready to get started. And also, I showed you some modifications, but I don't like my lighting, y'all. I'm working on this. I am not a, what's the word called? I'm just a pelvic physical therapist trying to teach everybody what to do and what they can. So this is not my expertise, but I'll do the best I can. So I've talked about constipation before, and I'm talking about it again because I was doing some social media, and I recognized that was an issue that somebody was dealing with, and a couple people asked me if I could do it. And I know in the past we've talked about just constipation, but what I'm actually going to show you is different ways that you can be able to help get that digestive system going when it's time for things to be exiting. So I'm going to go ahead and start just with some colon massages, and you can do this yourself as well, but I'm going to describe it on myself how to do it. Then I'm going to lie down on my back, and then I'm going to do it as well. And you can do this yourself, so you don't need anybody to do it, okay? So so if you think about, and there's different reasons, again, as to why somebody may have constipation. I've done previous lives on it. I will touch up on it at the end. But if you're having constipation, okay, first, this is the abdominal region, right? So, and I know I'm opposite of you, but you have your esophagus as it comes down, food comes down. Then it goes a little bit more to the left. That's where the stomach muscle sits right here. Then, not muscle, but the organ, the stomach. Then it goes into the small intestines, which sits right in the middle. It's a lot of area there. And then it comes out and goes into the right side of your abdomen. And this goes into the intestines, the large intestines. So the small intestines is in the mid component of your abdomen. And then it goes into your large intestines, comes up in a clockwise manner, which is near your ribs, comes across, goes to the left, and then drops down. That drops down into the pelvis. So it's important just to also realize that when you're dealing with we do temperature checks in our office. When you're dealing with the pelvis and you have the rectum, so I'm going to leave the bladder and the uterus out. When you have the colon, so if I'm going in a clockwise manner and then I'm coming down and emptying into the pelvis, well, at the end of the pelvis, that's where the rectum sits here. So that is the organ that helps empty it out. So, but sometimes, again, you may have issues with constipation because it's getting stuck in transit. It could be getting stuck in transit of the process of coming through the colon, or it can be getting stuck at the exit. So if it's not the exit and it's only during transit, the biggest thing is trying to get things moving. Just get things moving. The biggest thing is with the colon is if you're constipating, it's drying out too much. Too much of the liquid is being extracted out. And then also too, the muscles are too sluggish to push things through. So what you're going to do is you're going to take your hand, and again, as you get out the small intestines and then go to the large intestines, you will be on the right side of your body. All you're doing is you're just stroking up. You're stroking up. Now, you may stroke a little bit more to the right than me or a little bit more to the left. Everybody's body is a little bit different, but you're still in the area. So if you're not quite sure if you're getting it, you can maybe use two hands and give it more of a broader surface component with your fingers and stroke up. It's not firm, but enough just to feel like you're getting a little depth in it, and then you're pulling up. And you're going to do that 10 times, right? And I'm going to do this too. Once we get here, then we're going to shift and go to the transverse component of the colon. It goes from the rib to the other rib. Then we're working our way here. So pretty much you're helping usher what's sluggish, muscles that are not doing what they need to do, and you're pushing it along the way. And you're going to do this 10 times in each position. Then we're going to dump down, right? And that's the descending colon. That's the component of the colon that then goes into the sacrum and exits through the rectum. Then we're going to work on pushing down 10 times. So I will do that. Again, you don't want too much pressure, but you want to give it a little bit of pressure. It should be comfortable for the most part. You're going to do this every day at night, okay? So I'm going to, and if you're at a position where you can do it as well, I want you to do it as well. Hopefully, a little cheat sheet. Let me scoot a little bit because I want you to see directly over my stomach. And hopefully you can see this. If y'all can't hear me or anything like that, drop a little comment. And we say we're going below the skirt, right? Okay, so if we're here, I'm going to take my hand and I'm going from a clockwise manner. So I'm on the base. You feel that bony prominence is right here. The bony prominence is here. I'm taking my fingers just to make sure I'm not too far over or not too far to the other side, just to make sure I'm getting good, the whole area. I'm going to stroke 10 times. And it's very simple. It's not something that needs to be exaggerated. All we're trying to do is the muscles that are being sluggish, that are not doing what they're supposed to be doing, we're just trying to help facilitate it. So I'm going to do this 10 times, and I'm going just to the base of that bony prominence there, that hip bone, and I'm working my way up. I'm going up to my rib because that's where the colon goes. Up to my rib 10 times. And that's about 6. And I'm really kind of getting in there, but not too much. Not too much. And you need to make this a practice every day. Because if you're constipated, it may be the frequency that you're going. You may be going less than 3 times a week. You may be going every other day. That's going into constipation. Or you're going, but you're straining. All right, now we're going to shift and go across the transverse component of the colon. That is from that rib bone to rib bone. We're shifting and I'm going over. And if you have any questions, drop it in. And you may feel some gassy sounds. Again, we are in the intestine. What comes out the intestines besides poop, right? Bowel movement. What comes out? Gas. So you may feel like you're going over some gassy bubbles inside there, and that's okay. All right, so this is about 10 right here. Oh, I heard some bubbles. Did y'all hear mine? All right, now I'm going to go from the base of the left rib cage, and I'm going down and I'm going to bucket into my pelvic. So this is my pelvic bone. Remember that rectum sits directly in there. So I'm really wanting to get it down there, okay? So I'm pushing here. And you may just into what I do with my clients when we're doing movement, skin, or anything, you may want to put a little bit of lotion there, especially if you're going to bed at night after taking a shower. Put some lotion. It'll allow a little bit more, it won't be as much friction because I'm having a lot of friction right now. So I'm going to use my fingers here, and I'm just pushing that area out. Pushing all the way down. I really hear my stomach making some noises. Bessie's talking to me. And I'm doing this 10 times. And this is like, again, this is just a good way of help jump starting that colon, because some of you rely on some form of laxative for a bowel movement. And, you know, you have to do what you have to do, but we need to teach if medically we're okay for the most part, we've got to start learning to teach our body to do what it's supposed to do. And a lot of times things work, but they may be out of sync because of some of the behavioral things we're doing. I'm not saying you're crazy. It's just some things that we need to work on modifying in our everyday routine. So that is a colon massage. And actually, I kind of feel a little bit looser here, to be honest. So going from the hip bone all the way up to the base of the rib, expanding that area 10 times. Then going to the transverse colon component. You're going from rib to the other rib 10 times. Not too much pressure, but enough. 10 times here. And then you're going from the base of the rib down to your pelvis. But making sure you're going not just here to the rib, try to go into the pelvis a little bit, right? Because that's where the rectum is, the exit component. Now, if you say, hey, I'm having constipation and I really feel a little bit looser. And again, your abdominal muscles help push things out. And when I always talk about the core, y'all, we're going to do a core challenge too in the future. I don't know when, but in the future. It is so important. The core does so much. If you don't have a good core, if you're not using your core, it will affect how your bowels moves as well. So you may say, okay, I am not having my constipation is not through the process, the transit. Because some of you, when you're feeling, this is what I hear from my clients, they say, it's not stuck at the exit. It is actually I feel it just sluggish. I feel it sluggish. Now, if you're having it and it's feeling stuck at the exit, as I've said before, and I don't have my step stool in here, but if I use this chair, my little cheat sheet. If I use this chair, act like I'm sitting down at the toilet. If I'm sitting down at the toilet, you can get something that's called a squatty potty or a step stool, just something that's going to allow your legs to lift above your hips. That's going to put more of a turn for that pelvis at the back. And Virginia's right over there, but that's going to put a tilt up the pelvis. That's going to allow more of an exit of the fecal matter, which is the bowel movement, which is the poop. Those are the different terms. So if Virginia is tilted a little bit more, well, if she's here and we lift our legs, that is then in return going to allow more of a tilt to allow the bowel movement to come out a little bit better. So again, sitting there, if you say, hey, I feel like it gets stuck at the exit component, well, that could be common for someone who has a prolapse. So what you can do is you may have to brace that prolapse. So what you would do, if this is your vaginal canal, right? So you have your bladder that sits to the front, you have your vaginal opening that sits here, and then you have your rectum that sits right behind, right? Where bowel movement comes in. If you're having a prolapse, say the rectum is shifted forward, then bowel movement's not going to come. It's going to get stuck. So you'll have constipation at the exit. So what you can do is you can vaginally insert your finger while you're sitting down and brace. You can take your hand and you can push back. So my hand is in my vaginal canal. Wash your hands. If you say, hey, I can't do that, put some gloves on. But we know we've all been young. We've all done stuff. So don't act brand new to you, Virginia. So go ahead and stick your finger here. And then, this is the hole, then you're going to shift back to brace it. So then, if you're having a prolapse that's called a rectocele, that's where the rectum shifts forward, it won't get stuck. And I'm doing it with my fingers, but I'm realizing that's not a great simulation of that. So if this is the rectum, and it's sitting right behind the uterus in this manner here, if the rectocele, which can be a prolapse, if it's pocketing into the vaginal wall and dropping, can you see how it could get stuck? So, but if I insert my finger into the vaginal canal and shift the vaginal canal back, it then allows a more of a downward, smoother component of the vaginal of the bowel movement coming out. We call that vaginal wall bracing. So depending on what's going on, you're pushing to then allow an easy access versus it pocketing forward into there and then getting stuck. So that's another thing that you can do when it comes to like mechanics. If you're having bowel movement issues coming out, maybe you say, hey, I'm constipated because I'm having hemorrhoids. I know I'm going to a whole different manner of things. Well, hemorrhoids can be different reasons. It could be from straining. It could be from, a lot of times it's from that straining component. Now, you may have to use, I forgot what the thing's called. I forgot what it's called. And when I had my baby, after my first child, I had a small hemorrhoid. I did. And preparation H, that's what it was. You can maybe use that if that is stopping you, because sometimes pain from a hemorrhoid, may you feel like you're constipated, but you're not constipated. You're becoming constipated because it's too painful in reference to because of that hemorrhoid. Or if you have like a little tear in the fissure of the rectum or the exit component, using some preparation H, that'll definitely help with discomfort. So hopefully those are some good tips. Again, you can use colon massages, or you can use the squatty potty or something that's going to elevate your legs, or you may need to do some type of vaginal bracing so the bowel movement can be able to come out in a smoother manner. Those are different mechanics that you can use. Again, if you're having a problem with constipation, look at your dietary component. Look at how you're exercising. Movement is what is needed for you to be able to allow that fluidity, things to be fluid. Motion is like lotion. No, yeah, that's how it goes. Motion is like lotion. You got to be moving for things to be sliding and grooving. It's the same thing. So you've got to exercise. You've got to make that time. And I know as women, we're like, man, we got this. If you don't take care of it now, and it is a chronic condition, it becomes chronic or continues to be chronic, it will cause other problems in the future. It will increase your risk of having a prolapse. Okay? It can increase your risk of having a prolapse. So again, making sure you're exercising, that helps with movement. Making sure you're working on core strengthening. If you're new to the group, thank you for the newbies that come in. I did this specifically for y'all because y'all made a comment out there and I kind of jumped on that. And I have never done this with the group. So thank y'all for y'all's question and wanting me to do this. Making sure that, again, like I said, exercising, making sure you're doing some core work, getting these core muscles working. Hey, behind the core muscles, what's behind the core muscles? The intestines, the colons, right? Those are there. Behind that component, then you have your back muscles, right? And then you have your spine. So all of your organs are in actuality supported by muscles. So if you're sedentary and not moving that, how do you expect your colon to move? Does that make sense? Making sure you're drinking enough fluid, because again, the whole point of the large colon, which goes from the right side all the way to the left side exiting, its job is to dry out the colon, right? Because if it doesn't dry out the colon, you're going to have diarrhea. So if you're somebody that deals with irritable bowel syndrome, IBS, or deal with Crohn's, you can have diarrhea or constipation. So if you're not even taking enough fluid, and when I say fluid, it is not necessarily just water. I mean, taking water is very, very important, but if you're drinking teas and coffees, those sugary drinks, they dehydrate you sooner. So if you're doing more of that and less of the water, when it's time for that nice poopy baked poop, we're going to say it like that. Once the poop is in the oven, you pretty much taking that poop. If you haven't drank enough water, you putting that joker on broil versus baking her at 350 like we cook chicken, right? So the biggest thing is making sure you are drinking enough, so then when it's time for it to go through the process, you still have some type of fluid that's there. But if not, it's just like, ain't going. And we're going to be straight. This is below the skirt with Tamara. Have you ever been to the point where you've had sex and it's been dry? Your vaginal canal is dry. You've had to have lubrication, right? So could you imagine something being inserted into you, whatever your means is that you do? If you do gadgets, if you do whatever, if you do the real thing, however, whatever makes you happy and get you where you want to be. If that is really See, that's when my mind going somewhere else and I need to be focused on educating y'all. See how that happens? Pretty much what I was saying, just like if you're having intercourse of some form and you're inserting something and you're dry, that's the same thing. So you need to make sure you're trying to keep yourself just as hydrated. That's what's going on. So that is that. I want to also say, make sure you're having some type of form of fiber in your diet. If that's oatmeal, whole grains, whole grains, whole grains. That is what you need. White rice, think about it. The brat diet. When you have diarrhea, what happens? You want to stop yourself up. You go through the brat diet. They want you on the breads, the rice, the apples, the toast. I'm sorry, bananas. So if those are things that are going to stop you up, if you're already a stopped up person, you're welcome, Nikki. I see you. Thank you. You're welcome. If you're a stopped up person, you don't want to be putting things into your body that is making you even more congested. So whole grains, nuts, fruit, those are things that you need. Beans, those are things that's going to help allow things to be able to go a little bit smoother. But if you're doing a bunch of pasta all the time, rice all the time, especially down south in South Carolina, I mean, that's what we do. We do soul food. And that's something I've pushed myself away a whole lot. But when I do indulge, I do. But the biggest thing is just making sure you're getting that well balanced. Everything is done with moderation. What you put in yourself is what's going to come out. If you put a lot of stiff stuff, things that are not doing what they need to do, it's going to come out stiff and you won't feel it. So there's no need, unless, like I said, if there's nothing else going on, there's no need for you to be having a full workout on the toilet between your Virginia and the toilet seat. Like, you don't have to be that way if everything is fine. The biggest thing is make sure if you're having something that's chronic, that has changed, get assessed. Make sure there's nothing going on. I know people, I'll be honest, my husband's best friend passed away about 3 months ago. He had just turned 50. He was diagnosed when he was 46. He had colon cancer. So pay attention. If you say, hey, I've noticed, and I spoke with someone before recently, and they said that, hey, they went to the doctor, they had these imaging, they did everything you need. If you notice something changes, first get assessed, get some imaging, making sure that something else is not going on. If nothing else is going on, then you need to do your part. You need to do your part. Eating properly, drinking how you need to, plenty of fluid during the day, and watching your mechanics when you sit on the toilet. You should not be sitting on the toilet longer than 10 minutes. You go in there and you do your business. If you cannot do your business within 10 minutes, you need to get up off the toilet. If the situation comes back, you have another urge to have a bowel movement, then you go back. But don't sit longer than 10 minutes. That's going to allow you to strain. That's going to increase your risk of having hemorrhoids. If you do have hemorrhoids, it's going to progress it. So again, not sitting on the toilet long times. Lift your legs up when you're elevated. So I'm just teaching you just different mechanics when it comes to your poop game. This is what you got to do. We should be looking for nice, smooth poops. We should not be looking for lumpy poop. We should not be having lumpy poops or poops that look like rabbit pellets all over the place and got a couple drops. That's not a good bowel movement. No, it's not. So I want you to challenge yourself. Set yourself a diary. I do this with my clients. Get yourself a diary, and every time, you just write on the log. When do you notice you have it? Start getting yourself on a routine. For me, I go to the restroom every morning. If I don't go, I'm like, what's going on here? Right? May catch me later, but usually it is every morning, same time. So get yourself a log. Keep a track how often you're using the restroom. Describe what it is. You may want to hide that joker because you don't want your husband or your boyfriend or your children getting it, but describe it. What time is it starting to happen? Describe what it looks like. If you have it, write down the food that you had that day. So if you had a bowel movement, say you're somebody that goes every other day, right? You write down what you had, think about what you had the day before and kind of write that there, right? And you'll start noticing the biggest things you need to see what is allowing things not to happen versus what is allowing things to happen. And sometimes we don't recognize it until we look at it. That's why I have my clients do a log. And there's a lot more specific more than what I'm telling you. But give yourself a log so you can see what's going on. And if you continue this, getting things moving, eating right, exercising, doing the mechanics you need to when you have a poop, those are the things you should notice a difference. If you, and you know, I'm queen at saying this, if you are intentional in return will then turn over into some form of consistency. Now you may half do it, then you're going to half be consistent, but you are still intentional. So intentional, getting 50%, if you're only working 50% intentionally, then you get 50% consistency. That's better than not even trying. So you need to start trying. And when you try, you'll start noticing some gains and some little wins. And that's going to build upon that. And it's going to allow you to continue to step up your game. And you may start realizing you need to do a lifestyle change. And what you do for yourself and how you treat yourself, what you put in yourself, if you have any offspring, and I can say that for my kids, if I can't teach them to do something that I'm not doing. So if my daughter has some rabbit pellets in the toilet, because I always check their poop, they know what time it is. If she's not eating right, she's going to get the product of that. But it's not her fault, because it's mommy's fault to make sure she does what she needs to or get some type of supplement. Say you say, I can't really eat like that. Option. I'm not a nutritionist. Do a smoothie. Put the different things in there. I used to do Well, yeah, I haven't been as consistent. See, I just told myself it's true since I have this whole pandemic. But right before, and I do it every now and then, but when I was working big routines, in my smoothie, I put protein in there. I would put mango, I would put avocado. Really can't really taste avocado. You know, it's kind of a bland taste. A little bit of avocado. I would put peanut butter in there. I would put oatmeal. I would put flax seeds. I would put almond milk, because I'm trying to stay from that dairy. That affects your, lactose stuff if you have those issues going on. Those things I still have good poops, but those things was beautiful. You could have got an A++ on that one. But if I knew I may not have put it in, I would put spinach in there. Like, you don't even really taste that stuff with the fruit and the strawberries and the pineapples. Like, it's very enjoyable. Oh, there's an app for that. I use it. Hey, Nikki, what app are you using? Share with everybody else. If that's an app, is that an app for your log? I know I'm probably a little bit on a delay, but if there's an app, definitely drop it in there. Y'all, I'm not really the most hip to IT. I tell y'all that all the time. So we can be a resource for one another. So if there's something that you can do, definitely share. And I'm learning too, and I can share that with my clients as well. So I'm gonna give Nikki a couple seconds if she can drop it in there, because I try not to stay on longer than 30 minutes. But just wanted to kind of come in here, talk about massages, cold massages. You can track your poops, yes. Do you know the name of the app? And what I can do, y'all gonna give me some work. I'll work on trying to find an app, and I'll drop it in these comments. Thank you for thank you, Nikki. She says call the Poo Keeper. You can keep track of all that information you mentioned, from color and size. Beautiful, beautiful, beautiful. So Poo Keeper, for those who want to track it, that is great. I'm going to actually do it myself so I can be able to share with my clients. So thank you for that knowledge. Reach one, teach one. That's what we do for one another. Pat also said, I really need to do smoothies for breakfast. Yes, that's when I did mine. So just giving you some things that you can work on. Hopefully this is some tools for your toolbox. And again, if you have anything else that you want to say or you want me to talk about, I think I caught everything. I did. Yes, I did. Definitely, send me, if you don't want to put it in the comments or you don't want to, whatever, always DM me. And I'll, just like that, I spoke with somebody to the side, and then that pushed me to go ahead and do this type of live. So, but it's been great. Y'all, tomorrow step back up onto doing the squat challenge. Today's day 8. Today is rest. We pick back up tomorrow doing 50 squats. If you can't do squats, again, if you're having a lot of knee pain for whatever reason, I did do it a modification. If any of y'all know how I can pin that, what's the thing called? The squat log to the top so people can see it, let me know. I can always YouTube it, but I can do that. But y'all continue to push. I'm trying to be y'all's AP accountability partner with that, but y'all got to help me as well. But I have been doing them. So again, I think I'm going to take a picture of my legs now. This is day 8. And then I'm going to compare that to day 30 when this ends, because we will be doing 150 squats by that day. Now you may say, hey, do I have to do 150 squats? No, you don't have to do it all at one time. You may want to break it up. You may want to do 75 and 75. I'm just playing. You may want to break it up, do 25 a few times during the day, but just you got to get the 150 in when we get there, or you're doing 150 leg raises or whatever modification I showed you in that video. So I hope you ladies have a good rest of the evening. And I look forward to seeing you next week, Tuesday at 8. And if you know of any women that would benefit from this community, which every woman would, because 1 in 3 women have some form of pelvic dysfunction, invite them to the group. So y'all have a good evening. Bye-bye.